The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
Hey, we're back with another dose of our Healthy Dose podcast. I'm Dr. Joe Gambardella of Advanced Physical Medicine and Rehab of Miami. A pleasure to have with me tonight Dr. Gail Behar. How you doing, Dr. Gail?
Very good, thank you.
All right. It's the early part of the year. We just got done. It's about 7 o'clock at night, 7:30 at night. We saw almost 100 people in the office.
Correct.
Today.
Yes.
And here we are with all of you. We're going to talk a lot about injuries that have been really common toward the beginning of the year, where people have been wanting to get in shape, wanting to lose weight, and they want to do it all in a really short period of time. I think we had 8 new patients today. Neck pain, lower back pain, shoulder pain, hip pain, foot pain, you name it, right? You took all the x-rays, Dr.
I did. We took a lot of x-rays today of a lot of patients with all kinds of different conditions that you didn't imagine of.
Yeah. Let's take it from the top. People, they hear about us on Facebook, Instagram. Our Instagram handle is at APMRmiami.com. The office phone is 305-598-8788. You can check out our website at APMRmiami.com. Why is that so important? It has all of our new patient forms. When you hear what we're talking about tonight, you're going to go to the website, download the forms, fill them out, send them back to the office. So Dr. Gail, let's take everybody kind of through the flow of a physical medicine office, which is a group of doctors like ourselves. We work with medical doctors, physical therapists, physical therapy assistants. We have an amazing physician assistant that works with us full time, athletic trainers, massage therapists, and nutritionists, all under one roof here in Miami. So when a person comes into the office, they're having lower back pain, they enter some information into the office about what the injury is, how long they've had it, if there's any accidents or injuries that could have caused it. The very first person they see is you.
Yep, I'm the first person that takes them into the X-ray room. The first thing that we do is just take the history. We go over their personal history, the medical history, their past medical history, family history. We want to know exactly everything about that patient. One of the main things that we ask the patient is if they're taking any medications, for how long have they had their condition. Very, very important how the condition happened and for how long have they had it. A lot of the injuries that we see are injuries that patients have had for years, and until recently, they just recently discovered. Mm-hmm. We take the x-rays, and then that's when we find some x-rays we take, we see mild to moderate degenerations, mild to moderate conditions, and maybe we talk about what we do next, which is actually send the patient to take an MRI. An MRI.
Yeah, so why do we do these diagnostic tests? Why? There's a lot of offices that don't take x-rays, they treat patients, and it's really simple. To see is to know, not to see is to guess. We never guess when it comes to someone's health here at APMR Miami. When we look at these x-rays, we're able to see conditions like arthritis, degeneration, and potentially all of the things that we can't see on the x-ray. We can make a really educated guess as to what could happen. So for example, what can't we see on an x-ray? A herniated disc.
And let me interrupt you 1 second. I would like to let our patients know that we have a digital machine in the office, so we're able to see the patients within 2 minutes of taking the x-rays. So we actually take the x-rays and we're able to review with the patient right away.
Yeah, they get the results immediately. That's a great point. You don't have to wait weeks to get an x-ray report.
Nothing. Latest technology, we can see them right away. We can actually evaluate it. We do a physical exam, a thorough neurological testing in every patient that we see, and then we go into reviewing the the extras with them.
Yes. And when there are more advanced cases, for example, someone's having severe lower back pain, it's traveling down into an arm, it's traveling down into a leg, all roads are pointing to the disc. The disc is the cushion that allows the spine to move. It's also the structure in the body that, when injured, potentially can be the cause of pretty severe and significant pain. We have this model that we love showing our patients. It's a glass model that shows the bones being glass. You could see straight through them. The disc is completely white. You can see the spinal cord and the spinal nerves behind it. We show this to the patients. Why? Because this is everything that you can see on an MRI, everything that you can't see on an X-ray. So when we combine the two, the X-rays and the MRI, we have a complete diagnostic picture of what this patient has and how we can treat them appropriately. So just going over a couple of the patients that came in today, we'll talk about a shoulder and a knee. Relatively normal findings on an X-ray, consistent with their age. Our first patient here, Dr. Gail, was how old?
This patient was born in 1958, so relatively young. And what we find...
So about 60 years old.
And what we see here is that the patient has a type 1, type 2 slab tear. So
this is someone that comes in, they can't sleep on their shoulder. They can't bring their arm back to put their shirt over their head. They can't throw a baseball or a football anymore. And they're noticing clicking and popping in the shoulder.
We also see tendinopathy with partial thickness, articular surface, and intrasubstance tear in the distal fibers of the supraspinatus and infraspinatus tendons. Okay. Very common injuries.
Yes. Okay, so the muscles that help move the arm, what else do we see?
AC joint arthritis and subacromial bursitis causes a lot of pain.
Yeah. So there's about 5 conditions that can cause shoulder pain. This patient had every single one of them. Arthritis of the AC joint, that's consistent with aging and trauma. Poor mechanics, injury, usually a slip and fall where you'll land on your hands. Tendinosis or tendinopathy of the rotator cuff, that's the muscle that allows you to bring your arm away from your body. The throwing motion, all those muscles are involved. Degenerative changes within the capsule of the shoulder itself, called the labrum. Why was it important to get this MRI? I'm asking a lot of questions of myself today and of you, Dr. Gail. It's so important because all of these injuries that you just spoke about, when they're degenerative, they do not heal by themselves. So this is why the patient had these injuries and this discomfort for such a long period of time, but they're here to see us now at 60 years old. It was there at 40, it was there at 50, but it was manageable, and now it's not manageable anymore. This goes back to other podcasts that we've spoken about. There's a lot of different cells in the body that are responsible for helping us heal. Red blood cells, really important cells in the body because they take oxygen and move it all over our body so we can heal faster. White blood cells show up when there's infection, sore throat, colds. All of these different types of white blood cells will increase at various times to help stimulate our immune system to overcome these conditions that affect us, like colds and bugs. But these structural injuries like back pain, and in this particular case, the shoulder injuries that you mentioned, the first cells that respond to help the body heal are called stem cells. Really important cells that are involved with healing. And as we age, stem cells do one of two things. They either become highly active or essentially they become inactive and they go to sleep. If you have a stem cell that's inactive, that's quote unquote sleeping, and it's near the injury site, you are not going to heal at all. It is going to progressively get worse, and the condition will become degenerative over time, meaning that many, many more cells are becoming injured or dying off than your body could replace at one time.
Correct.
So when we get an MRI report like this back, and we're seeing degenerative changes, and a patient says, I do not want surgery, but we also know that physical therapy is not a appropriate choice for them at this time because the condition is degenerative, we let them know that, first of all, you're a candidate for regenerative medicine. Regenerative medicine, in this particular case, with a slap tear of the labrum, with rotator cuff tendinitis and tendinopathy, AC joint arthritis without severe degeneration, the very first thing that we want to do is get the stem cells in the shoulder working. We got to wake them up. And in order to do that, we spoke about earlier prolozone injections. Tell us what you tell your patients when you're going to let them know about these prolozone therapies.
Yeah, the prolozone therapy, they usually do the reactivation. They actually cause, it's like a magnet to the body. Yeah. So we actually do the injections on the side. The physician assistant does the injection on the side of pain, to attract as a magnet the cells that we have in our body and be able to reactivate those ones that we have dormant.
It's so important. It's so important because a lot of times you have the cells necessary to heal, but they're inactive and they have to be activated. Before you're a candidate for any type of stem cell therapy, you at least have to activate what you have. And a lot of times our patients will get better. The inflammation will start to decrease, pain decreases, their range of motion gets better. I'd say about 25% of the time, just by activating somebody's cells and doing some physical therapy and chiropractic, working on the alignment, the patient gets 100% better and does not have a relapse.
We also use laser therapy. Laser therapy is a new way to decrease the inflammation. Nowadays, a lot of patients don't like to take medications because now we've been seeing throughout the years that what used to be good before is not good anymore. Taking a lot of anti-inflammatory is causing a lot of damages into the liver, the kidneys, and damaging a lot of our organs. So the laser is the new technology to decrease the inflammation. It will penetrate deep enough to decrease the inflammation from the inside out. It's gonna prepare the area for the injection to take place and for everything to work better.
Yeah, excellent point. So the more activation of these stem cells, of our patients' own stem cells that we can get, the faster they're going to heal. Prolozone, as we mentioned, is an injection of ozone, B vitamins, selenium, zinc, B vitamins, amino acids. Yep, dextrose, simple saline. And your body uses all those ingredients to basically start repairing itself. And if the patient is young enough, say 25 or younger, that's pretty much all that they'll need. But if the patient is, let's say, 60, like the one you just mentioned, at 60, about 90% of the people are going to have some degenerative things that show up already. It's because of hormones that have decreased over time. It's because the body is less able to utilize and produce oxygen. The blood chemistry changes. And that's kind of the challenge that we have. So once this patient hits a certain age, and they're not making enough of their own stem cells, what do we have to do? We got to add more in. It's really simple. The purpose of our podcast is to make these treatments accessible to everyone by making everyone be able to understand what they are. So as we mentioned, these stem cells are the cells that respond to injuries. If you have enough, you're going to fully heal. If they're activated, you're going to fully heal. If they are inactive, you're going to start to break down and develop painful conditions. And if you don't have enough of them, the joint's going to begin to degenerate. On x-rays, what does that look like? Joint spaces look smaller in the lower back.
Decreases, very decreased. As soon as we take the x-ray, we see a decrease in joint space. Also, the bone starts to get degenerated.
Yes.
We see a lot of the bones, what is called the osteophytes.
The osteophytes
starts to show. Once we see the osteophytes in the x-ray, even if the patient has been with the space decreased over time, once we see the osteophytes, we know that this condition is progressing fast.
Yes.
Fast. So we see the patient today. If we don't do anything with the next couple of weeks to a month, then the condition might get to the point that won't be able to do anything.
Yeah.
That's why it's very.
Yeah, you know, we've spoken about this before. When you go to the mall, when you go to the park and you see people on crutches, people walking with canes, people in wheelchairs, people sitting in the middle of the mall, none of them started out like that. They all start out with a little bit of an ache or a pain. They ignore it. They take the medications to mask the symptoms, never to treat the condition, because there are no medications that are going to treat these conditions. No medication that you can take will allow your stem cells to grow faster, to allow your body to heal faster. They simply decrease the pain while the condition gets worse. Here at APMR Miami, our whole purpose, and we've dedicated our practice to allowing the body to heal by itself, giving it the ingredients it needs so that it could heal naturally and people could live to be 100 and be functional to 100. That's why we're here.
And I also want to mention that these conditions are available to all different ages. Don't wait until you feel like you're young and you don't need this, so you can actually regenerate. We start aging at a very young age.
Yep.
You know, we start degenerated and producing less.
The big numbers that we talk about between 20 and 30, growth hormone, a really important hormone in our body. It's the healing hormone. It's what keeps our heart strong, keeps our blood vessels soft, keeps our hair, skin, and nails looking really healthy. Most of it disappears from our body between 20 and 30 because we're done growing. It doesn't mean you need less, but that's the aging hormone. If you don't have enough of it, you age really quickly. Part of that is breaking down. you can replace that and bring it back into your body, get your body to make more. Between 30 and 40, 50% or more of the testosterone that your body needs to stay healthy, to decrease inflammation, to keep your bones, keep your joints healthy, to keep you looking the way you want to look, leaves the body and it's never coming back. You can't eat your way to better testosterone. You can't diet your way. There's no exercise that you're going to do to significantly increase the amount of testosterone that your body needs to feel good. And it's the same thing with oxygen. You know, we're less able to absorb or utilize oxygen to get our bodies to heal as we age. So what do you need? You need oxygen therapies. We have it here. You need testosterone therapy. Once we do blood work, we'll go over one today. You need it, you get it here. All of the things that we do are completely natural, safe, they're bioidentical, and the whole purpose is getting your body to heal by itself, just like jump-starting a car.
Exactly.
So you mentioned on this patient these injuries in the shoulder. What's the next MRI you have here today is what?
I actually have a patient that was involved in a motor vehicle accident. She came to the office with mild pain. A lot of the patients, mild to moderate, they feel they're okay. We do take the x-ray. We do the exam. We do the neurological testing. We go through everything. No matter what you tell me that you feel, we go through everything in extended. So I take the x-rays and I see mild degeneration and changes. The way that the exam the exam results does not correlate with what I'm seeing, because that's the thing. We always do the exams complete. So it does not correlate, and that's the next step. Send the patient to do the MRI, because there's things that are not there that we want to see.
Yeah, we can't see the disc, we can't see the spinal cord, can't see the nerves.
So when the patient came back, she was very surprised. She never expected to have a 3 millimeter focal right paracentral disc herniation.
That's an enormous disc herniation. So people walking around like that, it's almost like walking around with a broken bone. I mean, when you have a disc injury of that size, a tear of that size, you're a car accident away from being in really hot water. You're a sneeze, a cough away. So when people bend down to tie their shoe and they get that sharp shooting back pain, think of what your discs look like. Everyone should at some point have an examination of the spine to find out what your baseline is. Are you in alignment? Are you out of alignment? And that MRI. When there is no such thing as normal pain. When people come in and they say, I've had the normal back pain or normal neck pain, well, what does that make the person who doesn't have pain? They're not abnormal, right? So when you have pain, it's a condition. It's a signal that your body is not working properly. And so when we find out that they have these MRIs, much like what we found with the shoulder, it unfortunately is a tissue of the body that does not have the capacity to heal by itself.
No, when you start having the pain, it's because the condition has already advanced enough to show the symptoms. A lot of the conditions have been there for a while and they don't show pain until the condition is severe. Mm-hmm. So that was the level of C3, C4 on the cervical spine. She also has C5 and C6 segments, another 3 millimeter left paracentral disc herniation, in this case with compression of the thecal sac.
So the thecal sac is the spinal cord. Christopher Reeve, everybody knows who Christopher Reeve was. He was Superman. Big, strong, great-looking guy. Everyone thought he was Superman. He was riding a horse. He flipped over the head of the horse, landed on his neck, and he bruised his spinal cord. If everyone holds up their finger, not when you're driving, half the size of his pinky nail, that's the size of the damage that occurred to his spinal cord, and he basically didn't function from the waist down, had to use a ventilator to breathe. That's how sensitive the spinal cord is. So when you have these tears in the disc, these are not injuries that you're going to take lightly. There is a way to treat them properly, because without treatment, the likelihood of furthering these injuries is very high, and also the likelihood of having surgery at some point in time is high.
She has canal stenosis as well. And then there's another segment. So in this case, this patient has 3 different segments. This one is C6, C7. And we see in this one an annular fissure tear. Yeah,
so an annular fissure, that's a tear in the disc. All the fluid that keeps your discs healthy, that keeps you moving normally, has leaked out of the disc, and it's sitting against the spinal cord and the spinal nerve. And this person hardly had any pain.
She hardly had any pain. She came because she was referred by a friend to come see us just to get checked, to make sure that everything was fine. In her mind, she was perfectly. She barely...
Yep. So two things come to mind. So at APMR Miami, we're also affiliated with Disc Centers of America. You can check out our website, miamidisccenter.com. When these injuries occur, number one, when you're in an accident, within 14 days, you have to get these things checked. because you have benefits available to you to take care of them before they become problematic. Very, very important. Get checked. We work with the best attorneys in town, Feiner, Green, and Steiner.
Yes, we do. They're the huge company in South Florida, Steiner, Green, and Feiner. There are about 40 attorneys. We work with half of them. They're great. A lot of our patients are extremely happy. They've had great benefits.
And the purpose of that is opening up all these medical benefits to you. That's why you pay for the insurance. Why get insurance? Why do you have it? For conditions like this. It gives you the availability to treat it properly. So at Disc Centers of America, it's a pretty special organization that we're a part of. All of our protocols are based on a medical doctor's research, Dr. Norman Shealy out of Harvard University. He set the protocols on how to treat these disc injuries, whether it's a tear, whether it's a bulge, an early stage herniation, or a full herniation. There are specific ways to treat an L5 disc herniation as compared to an L3 disc herniation. The table has to be set at different angles, different weights have to be used. So when you have these disc injuries, there's only one place to come, Disc Centers of America, Miami. We're down here in Miami, Florida. We help people from all over the state. They come from Key West to see us. We have people that fly in to see us because the treatment that we do based on these protocols has been proven to be 92% successful.
We also customize the treatments for the patient. That's another reason why we do the MRIs. We want to see where your condition exactly, what segments are affected to be able to treat you. We don't treat everybody the same way. We customize our treatments. We create protocols for each of our patients, which is very important. Yes. Very important. Everyone is treated differently. Everyone is having a different care plan. We do write a care plan for every single patient. We sit with them and we write down everything that they require. And one of us, a doctor, we sign the care plan, and the physical therapies then guide them through the whole treatment.
Yep. So whether it's a shoulder injury, a hip injury, lower back, you're driving in the car listening and you have that pain, pick up the phone, call us 305-598-8788 and find out how we can help you. If it's a disc injury, most likely with a positive MRI, you're going to be a candidate for some sort of decompression therapy. We're going to use those specific protocols to allow your body to decompress, control the inflammation. We're going to use some sort of oxygen therapy to activate your stem cells so you can close the backside of that disc, get it to scab up, scar up, so that you become functional and mobile again. If it's a shoulder, a hip, if it's a knee, you're most likely going to be a candidate for some sort of oxygen therapy to activate your stem cells, get some of the healing going in those joints. When we get the MRI or the positive orthopedic test back, if the condition is degenerative but not bone on bone, you're going to be a candidate for some sort of tissue graft therapy that contains stem cells. Based upon your age, it's really simple. If you're 40, 50, or 60, the older you are, the more cells you need. We add those cells in, combined with the oxygen therapy, and get the body to heal by itself.
And we do, our main treatments are to avoid surgery, non-surgical spinal decompression, everything to avoid surgeries, because there's called, what is the syndrome called? Failed back pain surgery syndrome.
Exactly. We'll do a whole podcast on that, about people that have more pain after the surgery than they did before. So whenever possible, we're going to work on getting the body to heal by itself. Surgery is going to be an option. There's times that surgery is absolutely necessary, but it's not. It's the last choice, not the first choice.
No, we do work with different surgeons in the area, well-known surgeons, spinal surgeons, and all kind of different doctors, specialty that we do refer patients when in need.
Yep. So the biggest thing is, the patients understand what these injuries are because we have the diagnostics. They do the treatment. They're feeling better. You know what the biggest question we get, Dr. Gail, is how long is it going to last?
Yes.
And it all depends on a couple of key things. We're going to find out what those things are right after this. We'll be back.
Repair your body, replace your key hormone levels, allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years of combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788. 305-598-8788.
And we're back, Dr. Joe, Dr. Gail, talking about how to stay healthy during the new year so that you can reach your weight loss goals and your physical goals. Dr. Gail, we mentioned right before the break, one of the most important questions patients ask after they've gone through their therapy, they're feeling great, is When do I come back? How long is this going to last? And the answer is, it depends, right? It depends on what your body says. Almost every one of our patients that have these degenerative conditions are between the ages of 30, 40, 50, and beyond. So you know what we do? We do blood work. And what I'm going to do right now is review a full panel of blood work to let everyone know out there just how in-depth our analysis is and how we base our treatment on these specific test protocols. So this is a patient that came to see us. They were having lower back pain, pretty severe lower back pain. They wound up having a herniated disc. And the patient here, just to let the audience out there know what the age of the patient is, this patient is 58 years old. So we ran the lab work on the patient, and the first thing that we noticed was that on the complete blood count, the CBC with differential, we look at red blood cells, white blood cells. There was a marker called mean corpuscular volume. It has to do with the size and shape of the red blood cells. A couple of points out of range. Most doctors don't even look at it. As an anti-aging doctor or specialist that we work with here, that tells me that the patient isn't absorbing folate, B9, or iron, folate, B12, or iron. So we prescribe probiotics, right, and B complex. So what this does is it helps people who have neuropathy, numbness and tingling in their hands, people who typically have vertigo, brain fog, can't remember what's happening. These are some of the symptoms that show up when these blood markers are out of range. We get them on those products to get the body healing by itself. We look at platelets. This person's platelets are in range. They're not at risk or any advanced risk for having blood clots or strokes. Then we look down here, we look at the comprehensive metabolic panel, and we look at glucose, and we notice that his fasting blood glucose is 95. The normal range for fasting blood glucose is 65 to 99. Really good fasting blood glucose is about 75 to 80. So what's happening at this point in time is that as this patient goes to sleep, they're not able to metabolize all of the glucose or all of the carbohydrates or even all the protein that's in the body. They're not digesting well. We'll typically prescribe a protein, Benefiber, a Metamucil. There's all different types of fiber drinks that are really inexpensive that you can pick up at the supermarket that you take before you go to bed. What that does is it helps your body process a lot of these fats and sugars so that you wake up with a blood glucose level about 10 to 15 points less than what we have here with our patient. So what does that mean? Faster healing. When you heal faster, you heal longer and more completely. Next page here, we look at electrolytes. Chloride is out of balance on this patient. Electrolytes, many people, we live in South Florida. It's hot, traveling in and out of the cars, in and out of the offices. We're losing more water than we're taking in. So if the electrolytes are off, we need to change the diet. We need to take an electrolyte supplement. They're available. They're very inexpensive. They make you feel so much better, have so much energy, help you heal faster. Coming down here, we're looking at liver function, and what I see here is this patient there's a marker called alkaline phosphatase. The range is basically 40 to 120. This patient's range is on the low end of 50. In males, what does that mean? Most likely they're deficient in zinc. If you're deficient in zinc, you're going to be low in your ability to make and produce testosterone. If you have low testosterone, you're not healing properly. So with this person, taking 50 milligrams of zinc with some copper a couple of times a week would do wonders for their energy and for their ability to recover and heal. We also look at the liver enzymes. One of the liver enzymes, ALT, is out of range. When we see liver enzymes that are out of range, first thing I think of is insulin resistance, right? The body is not able to release enough insulin, or insulin is not being absorbed by body fat, by muscle, by the liver, and a lot of the sugar is getting stored in the bloodstream. And you're going to start to see elevated liver enzymes. And some of the symptoms, just so you know, if you're struggling with weight loss out there, if you're feeling extremely tired, if you have excessive thirst or hunger, if you feel like you could never fill up after a meal, if you're urinating frequently, as I mentioned, if you're getting numbness and tingling in your hands or feet, feeling more tired than usual, breaking down, getting a lot of colds, frequent infections, and we see it on the blood work, you're insulin resistant. You need to lose weight. There's a program for you here at APMR. We're going to help get you straight so that you know the diet that's right for you to number one, feel better, but also to make these treatments that we do last longer. Next thing we see here, lipid panel, cholesterol. So what do most doctors look at? Total cholesterol. Total cholesterol is well within range. So that's pretty much it for most doctors. But we look at the breakdown of the cholesterol. And this particular person, HDL, the high density lipoproteins, that's the part of the cholesterol that helps you make testosterone. It helps mobilize fats, taking them out of the bloodstream, taking them out of the blood vessels, out of the body, is extremely low. So we're much more concerned with a low HDL than we are with a total elevated cholesterol. This person's HDL is only 35. So they should be minimum 55 or 60. So that combined with elevated liver enzymes, elevated fasting blood glucose, this person's going to find it extremely difficult to lose weight, and the likelihood of maintaining their correction is low. So all of the things that we just mentioned, by some supplementation, the right vitamins, the right nutrients, are going to be able to take a procedure that they've invested time and money in, they're feeling great, last their entire life. So the next thing that we look at, testosterone. We mentioned before that the ranges of testosterone basically are, say, from 350 to 1200. This person is, on this test, 364. You know what that person is? Normal. Why? Because they're in range. Not normal for healing. They're in range, but they're not optimal. If you want to maintain healing, if you want to heal faster, if you want to get bigger and stronger, men's testosterone serum needs to be about 900. To see any clinical gains, it's got to be about 900. If you're at 300, the chances of re-injury, the chances of breaking down, the chances of becoming diabetic are extremely high. So by getting this test done, we're going to be able to help balance this person out by adding some testosterone into their daily life. Clean, easy, safe, effective. They're going to feel great. This blood type on this person is A positive. What do we know about that? More beneficial to be on a vegetarian type diet, low meat. We're going to figure out what kind of diet they're on and kind of gear them towards that. We look at estrogen. Their estrogen looks pretty good. Prostate is healthy. Growth hormone is on the low end. So growth hormone, what do we see in this patient just in the last 2 minutes? High fasting blood glucose, elevated liver enzymes, low testosterone, and low growth hormone. This person, the likelihood of having a cardiovascular episode is extremely high with this patient. And they came in here because of back pain. So there's so many different ways that we help people at APMR and Disc Centers of America Miami. It's not just a one and done treatment. This is a lifestyle change. We've dedicated our practice to changing people's lives by helping them repair, replace, regenerate, get on to doing the things that are more important than focusing on their health. One of the last things that we see here, vitamin D. This is a vitamin that works as a hormone once it's ingested. This helps you fight cancer. It helps fight diabetes. It helps protect your joints. It helps elevate mood. The least expensive, most important vitamin that can be taken, if you're a candidate, 24.5. The range is 30 to 100. Patient's a disaster, right? So the thing that we have to let everyone out there who's listening know is that 90% of what I just went over on this lab work will not be reviewed by your regular doctor. Partly because most of these ranges could be considered to be in range, but this person is definitely not healthy. That's why they have these disc injuries. If all of these lab numbers were optimal, the likelihood of them even having these injuries would be significantly lessened. So once you have these injuries, obviously get them fixed the right way. We're going to do it naturally. We're going to get the body to heal by itself. But most importantly, we're going to correct the lab work so that these injuries become a thing of the past and that the body's able to continually heal 50, 60, 70, 80, 90, 100 and beyond, right?
Yes.
So this is going to be a thing that we commonly cover. We're going to be, when you write to us on Facebook, we're taking questions. Check us out at our Instagram handle at APMR. Send us questions on Facebook about injuries that you have, any lab work that you have. We'll review some of these things and kind of generically give out some information about how we're going to be able to help you and advise you about some of the things that you can do to take care of yourself. We do these things remotely over the phone. We're here centrally located in Miami, Florida, 7170 Southwest 117th Avenue. Check us out at our website, apmrmiami.com. and MiamiDiscCenter.com. Tons of information. The phone number 305-598-8788. We have a huge patient portal with resources, including new patient paperwork and how to get in touch with one of the doctors directly.
Yes.
Right? Dr. Gail, you have dedicated a large portion of your practice to taking care of our Spanish patients.
That's correct.
Right, so people that come into the office, whether you're English speaking, Spanish speaking, whatever it is, feel completely at home and very, very comfortable because, we can communicate with them very, very easily.
Yes, I'm fluent in Spanish, so it makes it easier for our Spanish community to communicate with me and actually teach them about all these treatments that, unfortunately, in South America or the countries that we come from, we don't have these advanced treatments. We don't see them. So a lot of patients don't even know they exist until they come to the office, and then I sit down with them and I make sure that when they leave the office, they're knowledgeable. They know their condition well enough to be able to explain it to their family members and understand what the treatment is about, which is key. Here, we don't prescribe medications. We don't prescribe anything without letting you know exactly what you need. And the most important thing is for you to understand your condition and what you need to do to take care of it.
Yeah, it's incredible. This is, if you're going to a gym and you want to get in shape, there's spinning class, there's yoga, there's weightlifting, there's high intensity training, a gym that has it all. This is a medical center that has it all, state of the art right here in the middle of Miami.
Yeah, we're in the heart of Kendall, like I call it.
Right?
Heart of Kendall, 10 minutes from the Turnpike, 15 minutes from the 826. Great location. Everything is like a one-stop shop.
Yep.
All the care is in here.
And we're here Monday to Thursday, 9 to 1, 3 to 7. We work with the best MRI center down here in Miami. It's called CMI. We have a special relationship with them where we're able to get the results within 24 hours. So, when people go and they get blood work done, we have a full lab here in the office. Lab results are back usually within 2 to 3 days. MRIs are back within a day. So once you come in and get these diagnostics, the treatment starts right away. So start feeling better. Repair, replace, regenerate. We're going to be back next week talking about discs, shoulders, lower backs, knees. Dr. Gail's going to be with me often talking about some of the specific conditions that we treat. And we'll see you next time.
Thank you.